Welcome to Omnia Health Insights. Today we have with us Dr. Sali Mahmoud.
Hello, and thank you for having me today.
Dr. Sali, I'd like to ask you about the innovations in the industry and how is PCR testing being evolved and what kind of alternatives are being introduced?
So the innovation in the COVID era has been tremendous. Since the start of the pandemic, the acceleration of new kits and new methodologies has been very fast. Every day we have a new kit, a new method, a rapid testing POCT solution. We have many kits at the moment that give you the results within 20 minutes, which is a real-time PCR result, very sensitive, very specific. At the start of the pandemic, there was a lot of limitations. There was very limited supplies of kits, of PCR kits, of machines, but then it accelerated a lot and we had many options of kits and many options of machines as well. We have developed also the saliva test at the end of the year last year, in October 2020, and we did a pilot study with the DOH for school kids, and we tested about 2,000 kids at that time for the pilot study. That was developed really well. Sensitivity and specificity have been very close to the nasopharyngeal swab PCR. So since then we have been doing saliva PCRs for all kids less than 12 years of age, and it has been working very well. Lab technology has also evolved. It's given us a very rapid method of detection with a high throughput. We also deployed LAMPOR, which is a sequencing technology, and it is very sensitive because it's sequencing the virus and it's giving us the results within a couple of hours. Right now we are sequencing also the virus with whole genome sequencing, or NGS technology. We are using multiple methodologies, Oxford Nanopore as well as Illumina technology, and that has given us access to detection of variants and mutations. This is currently happening on real-time basis. We're on real-time basis detecting the new variants, the new mutations. We are reporting back to the DOH, we're identifying the variants, and we're helping with the surveillance to contain the transmission of the infection and of the variants especially.
Would you say PCR testing is still regarded as the golden standard, or will alternatives be adopted and will be used instead?
Well, even though we had a lot of other tests that have evolved since last year, like the antigen test, PCR is still regarded as the golden method. It is the most sensitive and the most accurate for sure. Antigen testing has given the possibility for rapid mass testing solutions for other countries. It's not very well adopted here in the UAE, since we have huge capacity for PCRs. So right here in the UAE, definitely PCR is still the gold standard for testing COVID-19.
With the pandemic, there's been an increase of demand in testing, especially in the lab. What kind of a response and impact has there been for pathologists, and what kind of techniques and methods have supported pathologists in being able to supply to this demand?
Well, the pandemic has affected lab business in general in a huge way. It affected the research, R&D, which has made the methodologies evolve a lot, and it affected the knowledge of not only pathologists, lab techs, biomedical engineers, quality people. I think it has given us, all lab staff, a big lesson in new methodologies and techniques. There has been also a lot of development in terms of automation, which is what we're always looking for at the moment, because as you said, the testing capacity has to be increased to cover the screening that we are doing here in the UAE. Especially in the UAE, we're doing a huge number of screening every day. So we're always looking for fully automated solutions. We're looking for liquid handlers, which can aliquot the samples from the beginning until the end. We have different steps for PCRs, which includes extraction, PCR, and then reporting. We're also looking for AI solutions to link the reporting to results, or report in the hands of the patient. So there has been a lot of innovation in that manner, and I think it's still ongoing. It's very impressive.
Yeah, definitely a very interesting time to be in, and especially for healthcare. Thank you so much, Dr. Sali, for that insight.
Thank you. Thank you. Pleasure to be here. Thank you very much.